Hi, I'm Doug Middleton. I'm a person who's worked in the NHS for many years. Recently, taking it a little bit easier, do some consultancy work, but work with people, developing people, and have a passion for the NHS.
Thank you. Having served over 30 years in the NHS, could you share your experience or perspective of supporting GP practices and the NHS with mental health over your career?
So I think when I started back in the mid '80s, there wasn't much focus on mental health. I think the GP practices they did more physical services, they provided care, they submitted claims, they got paid. It was a very different structure to what exists now. And then probably early 90s, there was a bit of a change in the policy. There was something called GP fund holding, which gave GP practices control of some budgets. And at that time, some of the innovative GP practices recognised that quite a lot of their workload wasn't about the physical health, it was about the mental health of their patients. So they used some of that budget for mental health services, buying counsellors or community psychiatric nurses and that sort of, so they could bolster the offering that they made to their patients to help them with their workload, but also to help their patients with the services that they needed.
Thank you. What changes have they had to make to support mental health issues and challenges more recently?
So I think following the fund holding sort of status and that sort of establishing those roles in general practice, there was an initiative probably 2008 sort of time, a government push around improving access to psychological therapies, known as IAPT, and IAPT workers were placed in each GP practice, certainly the areas I was working at the time, which was Solihull. And that really helped the practices again have qualified, established workers in their practice where they could refer patients into for some of the perhaps lower to moderate level mental health, rather than the serious mental illness which was dealt with by the psychiatry teams and in the hospitals. And that service continues, but more recently through the primary care networks that GP practices work in, they've got access to other budgets where they can buy services such as mental health practitioners. They can buy things like social prescribers, which are probably more linking patients to services in the community, trying to make the most of the charitable sector or community groups and send patients there that can support some of those needs that those patients have. And recently, health and wellbeing coaches. So certainly one of the primary care networks that I'm working with has taken on a couple of health and wellbeing coaches with a focus on emotional wellbeing, trying to make sure that those patients don't get stuck on a long waiting list for the IAPT services maybe, but they can then be referred into emotional wellbeing and get some lower level support, but actually some focus and dedicated support for them at the time they need it. So hopefully that's a service which is accessible almost immediately, not long waiting lists, and again can link them into other services that exist in that local community.
That's great, thank you. And what tips would you give to someone who's struggling with poor mental health or overwhelm at work?
I think sort of COVID has changed quite a lot of the way people can cope, hasn't it? So, sometimes we've got a better work-life balance, we can work at home, we can do that, but that's providing some isolation issues, I think, with some staff. So I would certainly encourage people to reach out to their colleagues, to their manager, but also to go to their GP practice. The GP practice can support them if they need it. There may be work-based support. Certainly some organisations I've worked for have counselling or wellbeing support services. Make sure you tap into those and use those. And the other bit, not everybody has this, but use your friends. Your network of friends are there to help you and support you. And certainly, my go-to would be phone a friend, go for a pint, and talk things through.
Lovely. Thank you so much for speaking to us today. Really appreciate it.